Well, some parents are getting ready to send their kids back into the classroom when school resumes, but you probably have a lot of questions about what to do, how best to handle it. What if your child is exposed to coronavirus or test positive for it? We thought a refresher on when to quarantine was in order. And joining us live is Kristen Kelly. She's an epidemiologist and the nursing director of infection prevention at IU Health. Doctor, you've always had an important job, but we are looking to you for answers, so we're glad to have you with us this morning. Let's talk about, first of all, a refresher course. We've heard a lot about isolation, but now kids are being around kids in a situation where they haven't been. What are some of the things that you want us to put first and foremost when we think about this?
So I think a couple things. First, parents can definitely enter into this school season with confidence. We've handled a lot of viral illnesses before. We can definitely handle this one. But it's important to remain vigilant and just have a good plan. So look for signs and symptoms in your child. Monitor for that. Those may be a fever of over 100.4, cough, shortness of breath, chills, muscle pain, headache, or sore throat. Similar to what we would usually do, but this year we have another disease to monitor for.
You know, we brought our viewers the news conference live when Governor Holcomb and state health leaders laid out the plan that really got specific about, you know, really grouping children in the classroom into these pods and learning through a cohort system here. Do you think that was the right way? And will that help the situation and maybe ease some of our fears about kids going back?
Yep, so we definitely have a lot more buzzwords this year with pods and quarantine and COVID, but all of these are really in line with the CDC guidance. It goes back to using the tools in the toolbox that public health experts really advocate for, that are based in science. Those are to socially distance, keep your groups small, and also to wear masks and perform hand hygiene. If we do these things well, we can definitely enter into the school system with a lot of confidence and capability to manage the situation.
And
it'll be, yep.
They're the state really specific about, you know, a possible exposure. So they're going to tell a family when they feel that there is a significant risk that a child may have been exposed to somebody else, maybe directly here. So they're going to tell you when you need to take your child away from school, but is there some more leeway that moms and dads should be considering?
Yes, so this is one of the biggest changes to prepare for, is that you may get a call at some point in the school year that your child may have been exposed to someone in their pod that has COVID. The health department will contact those that were within a certain feet of the child within a certain duration, 15 minutes or longer. And if that child was known to be positive with a lab test and your child was around them, you will be asked to quarantine for a certain number of days, upwards of 10.
Will you have to get a test, and do you keep your kids away from your other children if that's possible?
Yes, so that is a great question. If your child has signs or symptoms of an infection, then they should quarantine. Do not send them to school and get tested if able. If your child was exposed to someone who may have had COVID, but the results are not back and they have no symptoms, don't quarantine until the health department directs you to. So they will be in touch with your family. I know it might be a little bit of a scary kind of adventure, but with confidence, the health department's going to help you walk through what to do and how to do it.
Well, Kristen, thanks for helping us kind of sort through all of this. These are, different times, so we're all learning to adjust and figuring out what is the right approach, and it was nice to have your voice in the mix here. Thank you.
Thanks.
All right, have a good day.